clock, and we haven't gotten word it is running late. I'll try and give you a 2-minute heads up. Thank you.
Well, good afternoon. Before I get started today, I want to take a moment and address the news we've seen in the United States and here at home. Racism and hatred has no place in our province. And as Premier, I have absolutely zero, and I repeat, zero tolerance for anyone targeting the Black community or any minority group. I just won't stand for it, and we won't stand for it as a province. My friends, people are hurting right now, and we must acknowledge this pain. We must acknowledge where it is coming from. And that means coming face to face with some of the most difficult problems we face as a society. And many of these issues are deeply rooted. They stem from a history of racism and abuse. But it is not only by bringing these issues to light, it is only by facing them. It's only by working together that we can begin to address them. My friends, there's no doubt that this has been a very difficult year, the hardest we've seen in our lifetime. We've seen and faced unprecedented challenges. We've faced obstacles no one could have predicted. And no matter what we faced it head on. And it is up to us, all three levels of government, to work together to support people through these difficult times. I know many of us feel a little uncertain about the future, but I assure you, my commitment to you is that my government will always stand with you. As Premier, I will always be there for you. We will support people through these difficult times, and I know that for the next few months, many parents will continue working from home. Our kids will continue learning at home. And one way we're trying to support people through this period is providing relief on hydro bills. This is critical at a time when so many people are at home and relying on electricity. Starting today, we're announcing the new COVID-19 recovery rate for all time of use customers. Families, small businesses, and farms will pay a fixed rate of 12.8 cents per kilowatt hour, 24 hours a day, 7 days a week. This rate will remain in effect until October 31st. The new rate will simply show up on your bill. And for those families who are struggling right now, no one, and I repeat, no one, will have their power cut off because they can't afford to pay their hydro bill right now. We're extending the ban on the power disconnections for residential customers until July 31st. And today, we're also introducing the new COVID-19 Energy Assistance Program. This program will provide support to low-income families who are struggling to pay their electricity bills. It will provide a one-time payments to cover electricity debts incurred during the COVID-19 period. We're also giving our small businesses a hand up. The new COVID-19 Energy Assistance Program for small business will provide support to small businesses that are struggling to pay their electricity bills due to the outbreak. Right now, every dollar counts. And these hydro relief measures are just another way we're working to support you during this time. Thank you, and God bless the people of Ontario. Now I'll turn it over to Minister Rickford.
Well, thank you, Premier, and thank you for your leadership. I'm pleased to join you today from Kenora on beautiful Lake of the Woods to speak about the actions our government's taking to support Ontario's electricity consumers. At the beginning of this crisis, we took swift action to suspend time of use prices to support those doing their part by staying home. This past Saturday, we announced that our government will continue the suspension of time of use pricing. And starting today, June 1st, electricity customers will will be billed at a flat rate of 12.8 cents from June 1st to October 31st, 2020. Call it the COVID-19 recovery rate. Today, I'm also excited to share our government's plan to introduce greater customer choice for Ontario's electricity consumers. Beginning on November 1st, 2020, our government will offer electricity customers the option, the choice, to be billed by time of use or switch to a tiered rate electricity pricing plan. This action will allow Ontarians to choose an electricity pricing plan that best suits their household and lifestyle. Samedi dernier, nous avons annoncé qu'on allait maintenir la suspension de tarification selon l'heure de consommation et à compter d'aujourd'hui, le 1er juin, les consommateurs d'électricité s'y verront facteur un tarif forfaitaire de 2,8 cents appelé tarif d'électricité de récupération suite à la COVID-19. Ce tarif fixe demeurera en vigueur de 1er juin au 31 octobre 2020 et permettra aux consommateurs d'utiliser l'électricité quand ils ont besoin, peu importe l'heure. Je suis également heureux de vous faire part aujourd'hui du plan de notre gouvernement visant à offrir un plan grand choix aux consommateurs d'électricité de l'Ontario. À compter du 1er novembre 2020, notre gouvernement offrira aux consommateurs la possibilité d'être facturés au tarif selon l'heure de consommation ou de passer à un plan de tarification progressif d'électricité. We know the COVID outbreak has resulted in unexpected financial hardship for Ontario families and businesses, which is why our government is pleased to announce the COVID-19 Energy Assistance Program, which will provide $9 million in relief funding to Ontarians who are falling behind in their energy bills. Applications for the program will be available through local electricity utilities this coming July. And to help offset some of that small business owners' expenses, we are announcing the COVID-19 Energy Assistance Program for small businesses, which will provide $8 million of electricity bill relief funding. Notre gouvernement est fier de présenter le programme d'aide aux impayés d'énergie en raison de la COVID-19. Il fournira un financement d'urgence d'une valeur de 9 millions de dollars aux Ontariens qui parviennent pas à payer leur facture d'énergie à temps en raison de la pandémie. Nous savons que de nombreux propriétaires de petites entreprises ont également eu du mal à couvrir leurs frais de l'exploitation. Alors, pour contribuer à compenser certaines de leurs dépenses, nous lançons le programme d'aide aux impayés d'énergie en raison de la COVID-19 pour les petites entreprises qui fournira un allègement des tarifs d'électricité d'une valeur de 8 millions de dollars. Today, we're proud to announce targeted support for electricity consumers as we continue to spend more time in our homes and set a path forward as we recover, restart our economy. Thank you. Je vous remercie.
I'll just have a quick announcement before we get started regarding the testing. We have mobile units out in the field, and I just want to thank everyone. We had some really good numbers. I saw we hit 20,000 on I believe it was Saturday or Friday, and testing is going to start with a mobile unit all day tomorrow from 9 a.m. to 5 p.m. for the residents of Scarborough. They can go to 1250 Markham Road to get tested. For more information, go to Scarborough Health Network's website. So that's 1250 Markham Road in Scarborough tomorrow. Please, if you feel like you have symptoms and you want to go get tested, please go get tested. And even if you don't feel like you have symptoms, I'd encourage you to go get tested. So we're rolling out the mobile units right now, and we're starting off in Scarborough and going to be working around the GTA area. So thank you.
Okay, we'll go to the phone line for questions. First question. first question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Oh, hi, Premier. Thanks
Hi,
again
Lucas.
for taking our questions. I just want to start actually with the economy. We're just seeing more of those restrictions loosen, more businesses reopen, home stores, et cetera. But obviously, business owners continue to have many questions over certain restrictions. And I'm just curious that for that restaurant owner, that salon owner who have made those proper adjustments and are really in a waiting phase, and I'm sure you get this a lot, why not open things up now for them with the same rules and guidelines that are in place for those other big stores or businesses, that especially if they're adhering to physical distancing and mask wearing? What's the difference in those two scenarios?
Well, Lucas, we're looking at a regional approach, and with the Toronto and GTHA area, we're looking at a little different approach, because the numbers are a lot higher in the GTA and even certain parts of Toronto. So number one, we have to make sure that we're very cautious. We go through the health table to make sure they're okay with it. And like I've always said, Lucas, there's no one that wants to get this economy going more than I do, but I'm going to do it in a very safe and healthy way. That's number one. And we've come so far. I just don't want to chance anything. So we'll get there, and we'll be talking more about in days to come about the regional approach. But I'll tell you, this regional approach is very, very complicated, and we're just getting input from stakeholders across the province, associations across the province, and elected officials across the province to see exactly what this will look like.
And Premier, on the Ombudsman's announcement that he's going to be looking into both health and long-term care over the handling of the pandemic specifically.
Yeah.
What's not only your reaction to that, but it seems that Paul Dubé is doing this completely on his own accord with no complaints. You've said before that you don't believe that you've failed seniors in this province, but the fact that Mr. Dubé is just doing this, just going ahead with it, does that not show that the government did drop the ball in some way with seniors?
Well, let's be very clear. I welcome that. We welcome the Ombudsman to come in there. We welcome the Auditor General. I know the coroner is investigating, and possibly the police. Plus, we accelerated the commission. I need answers. I want answers. And we need to get this fixed, and we're going to get this fixed. Again, Lucas, this has been going on, as I talked to, and I won't name the politician, but talked to one politician, said this has been going on all the way back to Bill Davis. And it isn't one party per se, but I can tell you one thing, we will fix it. Our eyes are all over this, and to be very frank, everyone in Ontario's eyes are all over it. Everyone has a mother, a father, a loved one that somehow knows someone or is connected to someone within the 78,000 people are at long-term care. But we're gonna fix this problem as sure as I'm standing here.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hi, Cynthia.
Hi there, Premier. Hello. Sorry, I'm just getting my phone. It's all messed up on me. Can you hear me properly? I apologize.
I can hear you. Yep.
Okay. So this question is actually for my colleague, Tina Yazdani, and she's doing work on the pandemic pay for hospital workers.
Yes.
Yet she's still hearing from a lot of people that they are working very closely with COVID-positive patients, but they're not on the list for the pandemic pay. One ECG technician, for example, who sees 2 to 3 COVID patients a day. A lot of these people feel a little bit betrayed that your government isn't taking them into consideration as well. What do you have to say to them?
Well, first of all, I appreciate all the work that they're doing. They're on the front lines, and I appreciate it. I have to tell you, Cynthia, we have 375,000 people right now on pandemic pay. And as for the healthcare workers, if you don't mind, I'll pass it over to the Minister of Health.
Well, we did our very best to include all of the people working on the front lines of patients with COVID-19 in hospitals, long-term care homes, and home and community care. If we missed people, that wasn't done deliberately, but a decision did need to be made because the pandemic pay needs to get out to people. We have had interactions with the employers, webinars on how to do that. Those webinars have happened, may still be continuing, but our hope is that we are able to get the pandemic pay out to those workers as soon as possible, and it should be within the next week.
Okay, thank you. And my next question is for the Premier. Premier, there are still so many families that are so very concerned about their relatives in long-term care. We've seen a protest at one. We've seen a hunger strike. We've seen families now who are begging the province to take over the long-term care facility. Why are there still these deep-rooted issues and concerns even after the military has been called in, hospitals have been called in to oversee, but it still seems like those that are in troubled spots, and you said last week that there were 19,
Yes.
are still in very dire straits. And what are you doing to speed up getting the situation under control?
Well, we're connecting all of them to the hospitals to get hospital staff in there. We're working with public health. We're working with Ontario Health. We asked volunteers to come in. We're throwing everything at this. We're sparing no expense, and I won't spare any expense. And we're doing everything we can. Have we come a little ways in the last week or so? Absolutely, I think we have. And again, we won't stop until this problem is fixed. I understand, Cynthia, the pain these families are seeing right now of their loved ones, and hopefully, if the numbers come down eventually, and I don't know when, it could be a month, it could be 2 months, we can let people see their loved ones. That's the most important, to have them go in there and spend time with their loved ones. So I'm working very hard with public health on this to see when there's a time that we can let people go in and see their loved ones.
Next question.
Next question comes from Christina Tanalia from CP24. Please go ahead.
Hi, Premier.
Hi,
Thanks for
Christina.
taking my question. I
you.
wanted to ask you about funding for the municipalities. So today, Prime Minister Justin Trudeau announced $2.2 billion for municipalities in this country, but that's not new money. It was money already allocated for the municipalities.
Yep.
And he said time and time again during his news conference this morning that municipalities are the responsibility of the province. He said provinces need to step up, and that is what we are discussing now.
Yep.
The City of Toronto has said that they need $1.5 billion under a best case scenario in terms of their COVID-19 funding shortfall. I'm wondering how soon can municipalities like Toronto expect some help, and can the province afford to meet Toronto's needs?
Well, what out of that, I think, is $2.2 billion that the Prime Minister has offered. We get about 800 and I think it's 13 million, but it's existing money. That money is already in the budgets of these municipalities, so it's not new money. We need new money. I've committed to come to the table and help these municipalities, and we will. But we need the federal government to be involved. There's a lot of things. I could say that it's not the province's responsibility, it's the feds, and the feds could say it's our responsibility. Hey, we're in this together, and if we're in this together, we need a support. I just got to remind everyone in Ontario here, and this hasn't come up, but we pay $13 billion of your hard-earned tax dollars more to the federal government than we get back. So they have $13 billion of our money through payments, and I haven't seen the $13 billion on those transfer payments. So, and I have no problem helping other provinces, but again, your hard-earned tax dollars, $13 billion of it, are going to the federal government. So we need their support, and Prime Minister, it's all our duties to make sure we help municipalities, all 444 of them. I'm in there. We need you to be in there, and I appreciate them advancing the payment, but it's already in the budget, and we need more money.
Follow up?
Okay, Premier, thank you. My second question, your government is looking to extend the state of emergency in the province until June the 30th. So, of course, it's another month that people now are thinking they have to go without, businesses or services, perhaps even the potential that they're only going to be able to continue to meet in a group of a maximum of 5 people. So wondering if the motion passes tomorrow and the state of emergency is extended until June 30th, can Ontarians expect the easing of some emergency orders? And can you provide us with some insight?
Well, I'll give you my quick answer, then I'll pass it over to the Minister of Health. We're working very aggressively on coming up with a plan to get the economy going based on the numbers. And that goes back to our testing strategy, and we have a great testing strategy that we're rolling out. And 4 weeks is a long time, so a lot of things can happen in the 4 weeks, especially if we see the numbers come down. We'll be looking at other stages and again a regional approach. But I want to get this economy going, but I have to do it safely, Cynthia. It's absolutely critical we've come this far. But trust me, I want this economy going. I want businesses, small businesses, and large and medium to survive. But I'll pass this over to the Minister of Health.
Well, thank you, Premier. We need to take a careful and measured approach to any further opening up of the economy, i.e. moving from stage 1 to stage 2, based on 4 factors. The number of new cases, we need to see them continuing to go down. They have bobbed up and down a little bit in the last week to 10 days, but generally speaking, they seem to be going down. We also need to make sure that we have sufficient capacity in our hospitals if there's any surge in COVID-19 cases. We also need to make sure that we are doing adequate testing. We unveiled our strategy last week, and we are keeping the numbers of test cases every day up. There will be testing, as the Premier indicated, in Scarborough tomorrow, and we need to do the contact tracing as well. We have over 2,000 people on the ground right now doing contact tracing with public health units. We have had an indication from the federal government that they're prepared to help us with more people from Stats Canada. So we're going to continue to do that because we really need to measure at every step along the way what the impact is of each opening on public health. So we still need to go some distance yet before we're ready to start stage 2, but we need to do that so we can keep each and every Ontarian healthy and safe.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. Wanted to ask you about a number of outbreaks of COVID-19 that we've seen at farms in recent days. We've seen outbreaks in Norfolk County, down in St. Thomas, and also one in Niagara, specifically impacting migrant workers.
That's right.
And I'm wondering what actions the province is taking to address these outbreaks, and should migrant workers be on the priority testing list and be subject to sentinel testing in order to help protect them and also help protect the food chain?
Yep. So very good question. I'm glad you asked it because I was going to mention it. So you saw the numbers jump up to 404. One of the reasons they jumped up is 81 migrant workers in southwestern Ontario tested positive. And when they first came here, as they do every year in the season, they were self-isolating for 2 weeks. But to answer your question, I will definitely be addressing this with public health to make sure that we get all the migrant workers tested to keep them safe, to keep the supply chain, the food safe. But we're on this, and especially I saw those numbers jump up in southwestern Ontario there with 81 new cases. And overall on the testing, outside of that spike there, I don't know, it's looking better. I never want to get too overconfident because, as you know, it's like a roller coaster. You're up and down, but it's looking real positive. And I give all the credit to the people of Ontario. You folks have been incredible, absolutely incredible. That's the reason we're seeing some positive results on the testing there.
Premier, by way of follow-up on that, advocates for migrant workers say that they are exceptionally vulnerable in these situations. They've called on the province to step up inspections of farms and really to look at the cramped living quarters, the bunkhouses that migrant workers often live in on these farms. They say that these communal settings really make them vulnerable to COVID-19. And I'm wondering if the province will commit to making a change on that front and upping inspections and changing that housing or laws around that housing.
Well, that's something we can put on the table, any congregate living. And I've been there. I've seen the congregate living in these farms. And you make a valid point. Can we do it within a month or so? I just don't think that's reality. But what we can do, we can go in and test frequently. I think it's critical that we do. First, we'll do a test, and then we'll do another test in another week, and we'll continue testing to keep those people safe and keep the food supply chain safe as well. But I'll have more to talk about that over the next couple of days, and we'll be asking the Public Health and Ontario Health to start going in there and focusing on the migrant workers that are here, and there's quite a few of them.
Next question.
Next question comes from James Murray from Net News Ledger. Please go ahead.
Hi, James.
Good afternoon, Premier, and thanks for taking our call.
Thank you.
Question's probably over to Minister Rickford, and I'm going to hide with Minister Rickford. We're up here in the north where the COVID numbers are very low.
Yes.
And for Minister Rickford, you've been working on a lot of projects for small business. This energy program is excellent.
Yeah.
What other things are you hearing in the north that small businesses need, especially, say, for example, float plane operators and transportation companies?
Can Minister Rickford hear the question?
I sure can.
Okay.
Yeah. He's a little closer to me there here in Thunder Bay there. Thanks for the question. First on the energy issue, what we hear often, and it's across the province, it's not confined to Northern Ontario, is cost certainty. This is something the Premier, all of my colleagues have heard in extensive consultations with businesses, small, medium, and large, frankly. So in addition to options that we announced today in terms of pricing, certainty is something that they're looking for. Outside of that, obviously, as the Minister of Health said, we want to proceed out of an abundance of caution. There obviously is a desire to regionalize, but it can't be at the expense of communities in and across vast Northern Ontario where healthcare resources are not what they are in some of the larger city centres. And of course, our Indigenous communities proximal to us and across the vast north. So we want to strike that important balance, and I want to give a Kenora shout out to the Minister of Health, who at every step of the way has consulted with northern communities, and the Premier as well for listening carefully to what would work for us here in northwestern Ontario communities and striking that balance, as I said before, to move our economy forward. There's no question that these are trying times for small airlines flying for tourist operators, but our colleagues have been meeting and talking about these issues, and we're hopeful that in the not too distant future, we'll be able to address these more meaningfully.
Follow up.
Minister Mulroney and yourself actually put a bright spot in the transportation area with Ontario Northland Transportation, starting a route from White River through Kenora and up into Winnipeg. There are a lot of areas where transportation is still going to be needed in the north. Sioux Lookout, Greenstone, up near Greenstone Gold, and Sioux Lookout into Dryden and Port Francis and Atikokan. What can you share with us about plans for that, Minister?
Well, first of all, it was high time that we brought a world-class bus service through the Ontario Northland Transportation Commission across all of Northern Ontario. Ontario Northlands had largely served very well communities in northeastern Ontario. This has proved, as we announced last week, to be very successful, especially in the context of COVID. You know, for many people, especially those who can't drive, don't drive, some kind of transportation is still important to get to either Thunder Bay or Winnipeg and all points in between. So we've now been able to expand that service. I appreciate Minister Mulroney, all of my caucus colleagues for understanding how important this is. And we see a tremendous opportunity for growth, not just in terms of what Ontario Northland can do, but what other private carriers may be able to do in an integrated transportation network for all of Northern Ontario, opening us up for business, James, but making sure that Northerners have access to the essential services and programs that other people have across the province. It was a great day last week.
Next question.
That's great. I got to tell you, I love when I get questions from the north and rural communities, because a lot of times, you know, we don't get to address it. So by all means, if you're in the rural or northern communities, please call in and ask a question, because that's a massive part of our province, and we can't ever forget those folks. And rather than being Toronto centric all the time, there's concerns out there. So thank you for calling in, by the way. That's great.
Okay, next question.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Hi, Premier. Speaking of Toronto-centric, I guess the Star is now calling you. But I have a question that's more about the whole of Ontario. Tomorrow, you are going to ask the legislature to vote to extend the state of emergency for another 28 days. I just want to know what's the thinking behind that, because why don't you just do it for 2 weeks and then see, instead of going for this blanket 28-day extension?
Well, we're going to be, we need the ability to go out there and make quick decisions absolutely immediately. And every decision we've made, Robert's been transparent. As I've always said, as soon as I find something out, I'm standing here the next morning or next afternoon telling the people why we did it, what we need to do. But at least that will hopefully get us over the hump, per se. It's another 4 weeks, and we just want to make sure everyone's safe and healthy, and we want to get the economy going, and we need that tool to make that happen. But again, everything's going to be transparent. Anything that I know, you'll know, Robert. And sometimes, Robert, you find out before I do even.
We try.
But
Premier, I'm curious, are you going to extend? Okay, this is going to go till June 30th. You have a majority in the legislature, so you're going to be able to pass this. Are you going to then on sort of June 30th extend it for another 2 weeks or another 4 weeks, or do you think that this will be it and that we'll be through the emergency by the end of June? Because it'll have been basically from St. Patrick's Day to Canada Day.
Yeah, it all depends on the situation we're facing. If we're seeing that everything's moving in the right direction, numbers are going down, then we don't need to. But if we see that the movement hasn't happened, then we'll the option's on the table. But I just can't predict 4 weeks. And we actually, Robert, we have no plan right now. 4 weeks down the road, are we going to extend it or not? We're just going to do what we feel is right to protect the people in this province.
Last question.
Last question comes from Colin DeMello from CTV News. Please go ahead.
Hi, good afternoon, Premier. On long-term care, there are calls to take over Woodbridge Vista, given that staff are saying that they've lost confidence in management of the home, and the union has called for the province to step in. I'm wondering, what is your criteria to actually take over a home, and will it be applied in this instance?
Well, I'll hand this over to the Minister of Health. Thank you.
Well, we're still working together with the Ministry of Long-Term Care and the Ministry of Health to determine the status of those homes. Some of them are red. If there's an indication that the management of those homes are not willing to work with the staff that may be sent in by hospitals, that they're not willing to change their practices, then we will need to send in people, generally speaking, from hospital to provide that level of supervision. Because, as you know, we're dealing with a very vulnerable population who needs to have just basic care nets meet, being fed, being given something to drink, being given basic hygiene proposals, and so on. All of those things are really important. So if there's no indication that the management of that organization is going to cooperate with the staff that's sent in by the hospitals, then the hospitals will need to step in to provide supervision. We've done that before, and we'll not hesitate to do it again if we need to.
All right, thank you. And just to follow up to the Premier, I did some number crunching with a hydro bill based on the new rate that you provided, and you actually end up paying a little bit more with this new pandemic rate. So if you take a bill that was $59 under time of use, it actually adds up to $60 if you apply the new 12.8 cent per kilowatt hour rate. And it actually would have been $47 under the lowest tier, the 10.1 cent tier of time of use that a lot of us were enjoying for the past couple of months. Premier, how can you really call this relief when everyone across the province is going to end up sitting with higher hydro bills as a result of this new pandemic rate?
Well, I'm going to pass this over to the Minister of Energy, but I have to tell you, Colin, if we left the bill exactly the same and people are at home using more electricity, it's fine when everyone's at work and they come home, but it would have been a lot higher. So there's a considerable savings, but I'll pass it over to the Minister of Energy.
Yeah, sorry, respectfully, Colin, that may be a snapshot on your bill and a credit to your number crunching, but the 12.8 cents, of course, is cost neutral for the province. And it's lower than the on-peak and mid-peak ranges. So it's still a very low effective rate. It works very well for small businesses and farmers, and ratepayers. Households will notice very little, if any, difference from one bill to the rest. The 10.1 cent price per kilowatt hour off-peak rate, no question about it. It's helped families during the intensive part as many millions of families move to their homes as a result of this pandemic. But moving forward, we don't just intend to offer lower price rates. We want certainty, and that's what we've heard from consumers. That's what we've heard from small businesses and farmers, and that's exactly what we're offering. And then, as of the beginning of November, of course, they'll get greater choice. If time of use is something that's more suitable for you, Colin, well, knock yourself out, go to time of use, but other consumers will have other choices that work best for them, and that's what we're here to deliver.
That's great. Thank you. Yes, I just want to give a shout out. I got to give a shout out to our OPSU inspectors. We want to hear from them through their union. I want to thank them. As I mentioned, I want to thank the leadership of Smokey Thomas, Bob Eaton. You're absolute champions, and the frontline inspectors are absolute heroes. I know we had a little bump there, but I just want to tell you how much I appreciate you, the job you're doing, the sacrifices that you put in and day out. The government's relying on you. The people in long-term care are relying on you, as you just heard the questions. Thank you. I appreciate everything you do. Folks, have a good day. Thank you.